Let's get world. Let's get world.
Good morning, everyone. Hello, hello. It's Camille at Let's Get Oral with Jonathan and Lora Hooper. Lora Hooper comes from a hygienist gone periodontal therapist, coach, works with oral systemic providers, both sides of the fence. And I'm so excited to learn from her today what it looks like to start out in this space professionally and kind of the bumps and hurdles, but more specifically, how can we as patients find people like her to help us through our oral care problems?
Let's get oral.
Hey there, listeners. Before we dive into this episode with Lora, I want to share some very exciting announcements with you all. First, LGO is officially hitting the road this summer. Camille and I are going to attend some very nerdy mouth meetings in the coming months, such as the Totality of Care Symposium in Knoxville, Tennessee, and the Healthy Bite Oral Care Symposium in Salt Lake City, Utah. We look forward to connecting with everyone there, and we're stoked to be able to find ways to share these experiences with you all through the podcast. Second, we officially have an email. So if you have any questions, topics, ideas, or thoughts you'd love to share with us, please send an email to info@letsgetoral.com. Again, that's info, I-N-F-O, @letsgetoral.com. And lastly, thank you again for being a supporter of the show. It's crazy to think that it's only been a little bit over a year and a half since Camille and I started this, but the reception and feedback has been wonderful and very inspiring. So we're excited to continue bringing more engaging and accessible content in oral health, but also to bring you some more goodies, such as introducing merch and also ways to be able to connect with us while we hit the road and hopefully a city near you soon. With all that said, let's jump into this great and fascinating time with Lora Hooper.
Anyway, thank you so much for being here, Lora. How are you?
I'm great. It's an honor to be here. Excited to have some of these conversations today since they're relevant to what's going on and, in our daily lives, just to help your listeners and colleagues, really take a look at what's happening between medicine and dentistry.
Yeah, I'm so excited to hear your story specifically because you currently work in the space and I'm hoping for some really fun case studies if you could share some of those. But first, just tell us about your background, how you went from kind of, your journey to hygienist work and then moving into the periodontal therapy space and now what your current role looks like.
Yeah, well, I start off with, we're all hygienists at heart. Anyone who has an RDH, behind your name, I say it's like a secret kind of sisterhood. There are some men out there, so I'm going to give them kudos. But beyond that, it's almost like, right, you meet a hygienist, like, hey, I'm a hygienist, But there's this transition, I call it insanity. It literally was hygiene insanity. And I gave it that name because I remember saying to my parents, like, is this all people do? One, just the insanity of life of we wake up, we do the same thing, we go to work, and this is it. And so I had this revelation then hygiene. It was like, oh my God, I'm on repeat. It's like Groundhog Day over and over and over. Like literally you could record me having a brushing and flossing conversation and I could just hit play is how I felt. Like I didn't need to show up. So that kind of insanity of just watching people come in constantly bleeding, constantly inflammation, constantly losing bone, just and trying to do a great job. I mean, that's the sisterhood is we all want to be really good healthcare providers. But at some point I was like, there's, a definition of insanity is doing the same thing, expecting a different result. Like literally, it's what I was doing as a hygienist, just repeating new product, new brushing and flossing, handing the mirror, and it's like, and I'm expecting them to show up different. And so that really drove me to be like, what in the world is going on? Like, there's got to be a better way. Why aren't people getting better for longer periods of time, right? People get better, but why isn't this going away? And that really kind of made me take a step back. Like, what is it that I'm treating? Like,
Yeah.
what is the true definition? And so kind of like that little science piece of me kind of comes in. My kids call me a dental nerd. That, we live here in Florida, and it's like, you do not, they always tell, you do not want to walk up to my mom on the beach and sit down and see what she's reading. It is like, it's all safe, right? I can put any baby to sleep reading, some science on, oral pathogens or systemic health. But I think it's important is that most of us don't know the disease we're treating. And I relate it to really, I want everyone just to imagine like an orange dot, on a slide. And I define hygienist as we're trying to look at that orange dot. And I always ask people, like, what do you see? So just imagine this dot on the screen. And of course, people are like, oh, I see an orange dot. Oh, I see a sun. Oh, I've even had, I see, the flag of Japan, like,
Okay.
okay,
Yeah, of course.
on this like dot, I see a dot. And that's what I feel like we've been trained to look at. And to me, a periodontal therapist is a person who says, wait a second, what's all that white around the orange dot? So the orange dot is my patient. Like I've been so focused on like just looking at, the orange dot, the patient, and looking at, their disease or what's happening and trying to focus on that. And really to me, I started transitioning like, what's all around? Like what's influencing? What else do I need to look at? And so to me, that's that transition of periodontal therapist started saying, hey, there is high blood pressure. There is a person attached to, this mouth, right? We do have stress. We do have medications. We do have a lifestyle and diet going on. We have all this white space around this orange dot, and I need to look at that white space. And to me, that's what a periodontal therapist does. She's taking in, or he is taking in all that white space to say there's more than just that occurring. And how do I put that all together? And that's really what started as like my own sanity. Like I've got to find a better way. I have to start looking at my patients differently and then really start to say, okay, what is periodontal disease? Like what is gingivitis? Which takes me to the bigger conversation nobody has. Like what is health?
Right. Right. So
Yep.
when you're going through this transition in practice, I imagine you have dentists that you're working with. How are they viewing this transition for you?
Well, you kind of say, this path that I went on, I actually dragged my dentist that I worked for to veil denning method in 2011. I said, hey, we've got to go to AASH, the American Academy for Oral Systemic Health. So I say I'm like that seeker. I was like, there's all this stuff going on out there. We need that information. I need more. And so literally dragged her to this conference, and she was like, oh my God, this is stuff I've never heard before. Like the mouth is actually connected to the body. The mouth can be putting the body at risk. And that kind of started our journey. Really, we went to the veil denning. I think I was the third hygienist in the United States to get the preceptorship. And people who don't know what the veil denning method is, it's just a preceptorship that you are able to prevent heart attacks, strokes, and diabetes. And she brought her husband. Her husband was a cardiologist. So you have to
No
imagine,
way.
I've sat next to, so Dr. Golder's cardiologist, Dr. McClatchy's the dentist, I'm the hygienist, we have another hygienist there, Patty, and we're like lined up in the middle of it, they're like, half of all heart attacks are caused by an oral pathogen. Like, you need to be treating these pathogens. And I'm like, are we going to do this? Like, we have a cardiologist and a dentist. And literally, that just changed everything. We
Wow.
came back. They decided they're going to build a center going all in. Cardiologists left. Yeah. Cardiology, head of, hospitals, like,
Wow.
okay, it's what I want to do. I want to do preventative medicine. And so that really was the biggest step, is just the commitment as a team and having those team members. So yeah, I became the first hygienist to work for a cardiologist. I remember sitting there and thinking that day that, these doctors, so as a cardiologist, they were going to guarantee their work. They guarantee that a patient will not suffer a heart attack or stroke, ischemic stroke, or get diabetes under their care, or they get their money back.
Wow.
That's amazing.
It's amazing, but I'm going to say as a hygienist at the time, moving into that peritoneal therapist kind of mode, quite a bit of pressure.
Yeah,
bit-
that is
naturally.
significant.
Yeah, like you're going to take care of my patients. And the conversation was, well, just get rid of the pathogens that cause heart attacks. That's all you have to do. I have to do all these other things. Remember all that white space, but you just need to do this one thing. And it laid heavy, really heavy on me, because it was like, yeah, this isn't somebody just losing a tooth. This is somebody who could lose a life.
Yeah.
And I think when you start there, you start asking then a lot more questions than you've ever asked, I would say, in the frame of a hygienist. You start to ask more in a frame of a healthcare mind of like, what else is impacting? And my biggest thing that I love to share with hygienists is that really, to be a periodontal therapist, I'm not actually focused so much on the disease, on treating the disease. I'm focused on creating health.
Yes.
That makes sense.
And to me, that's what a therapist does. Like a periodontal therapist, my job was to create health. Because I truly believe, and Dr. Goodenow speaks a lot about this, like disease is dis-ease. Like we don't get these diseases just because they come in. No, we lose health and disease shows up.
Right. Exactly.
And I know you're a big believer probably in that. We'll talk about that. I'm speaking to the choir, but that's just how I like to get hygienists start thinking. Like, are you so focused on the disease, or can you take a step back and like, how do you actually create health? What health was lost? Like, why is this showing up? Because it doesn't just show up.
Right. So, what are the things that you're asking your patients? Because I know being in the health industry in general, it is often hard to kind of pull some of that information out of the patient. I know when I go in and they're like, "Oh, has anything changed?" I'm like, "Not since yesterday. Seems fine." But when I think about it, oh yeah, I have changed a couple things, and you don't really think too hard about it. So, like, what are your creative ways of kind of getting the information that you need from these patients?
Well, I definitely think communication is a huge one. I mean, we can't ask
Yes.
people yes and no questions. It's more of like, what has changed since the last time I saw you? I saw you back in September. Tell me what's happened, what's been going on. I think, we're so used to just like these black and white answers. And I think, part of that is communication style. The other thing is just really educating patients on why we're there. One of my biggest thing is just telling a patient, especially my new patients, is I'm your advocate. So I'm your health advocate. I'm not just looking at your teeth. I'm looking at your teeth connected to your mouth connected to your body connected to your family, and your family connected to the community. Because all of that affects your mouth, and all of your mouth is going to affect really every aspect of your life, but especially your body. And so I want my patients to know right out of the gateway, like bacteria in your mouth get into your bloodstream and wreak havoc other places. So we're going to take your blood pressure. We're going to talk about cholesterol. We're going to look at your health history because it impacts every system in the body. And then I just kind of get quiet. They either stare at you or they're like, oh, or I've heard that. I think it's kind of interesting that if you give patients the space, they want to fill it with a story. So they're like, I know somebody who had a heart attack, or I know somebody who, right, has had periodontal disease or diabetes, or, they want to tell you a story. And I think that's important because then they're making that connection for
Right.
you. Yeah. Instead
Yeah.
of you keep, and I'll say my hygiene days, when you call me a hygienist, yeah, I just threw up on my patients. I mean, obviously.
Right.
Blah, blah, blah. Instead of like, yeah, like, why are you there? Let them know. This is my job. I look at oral systemic health. How does bacteria in your mouth affect the rest of your body? It gets into the bloodstream. And I think that just opens the door for a different conversation instead of like, I don't want my blood pressure. I don't want to tell you on my medications. I think we can start to have then a little different conversation.
I feel like the RDH community is really hungry for this space in general. Is that a wrong assumption, or do you feel that too?
I do. I think it's kind of what you asked, like, how do they get there?
Yeah,
They're, and that's kind of what, we're saying, like, to me, it's like a mindset shift. We've been taught so like subjectively to look at our patients, like, right, everything's about, what does the tissue look like? Is there bleeding? Is there bone loss? And to me, we really have to shift that mindset to be more objective point of views. How we are in medicine is right. Because I can say somebody looks one way and you could come in and say they look a different way. That's very subjective. We're talking about
right.
millimeters. Did I have my, glasses on and my loops on, or is I just sitting there, finishing my coffee? The patient can look very different. And I think that has to be the first conversation, is just our mind shift, how we look at patients. Can we look at them the same objectively? And that's probably the biggest difference that I look at my patients. When people come in, are like, wow, you're like assessing the patient differently. And that's probably the biggest thing. I want as many objective things that I can do. And I think that's just mirroring medicine. We can all
Yes.
walk into a physician's office right now and, somebody can tell you look fantastic or somebody can tell you look bad. Really, just, I say, based on your meat suit.
Yes.
Somebody has a big meat suit doesn't mean they're unhealthy, and vice versa. Somebody could have a
Yes.
really fit or thin meat suit, I call it, and they can be very unhealthy. And I think medicine understands that. And so we need, as hygienists, to start asking, like, what is there objectively? What is there that I cannot see? Like,
Right.
what is really behind the mouth? And so to me, that's where I call them, there's 5 core things that I'm always going to do on a patient. And I think that's really important, is just to look at my patient from those 5 things. Now, some of those things hygienists can't do, but I currently work, at the Prevent Clinic with Dr. Gina Pritchard. So I'm able to do those things, and we do them on all the patients. And so, people ask me, well, what are those things? Well, of course, we're going to look at their blood markers. So, they're getting their blood inflammatory markers, and we can kind of get into that because that's a huge piece of oral systemic. But really,
Yes.
from a dental perspective, to me, the rest we can do. We can do salivary diagnostics. Like, what is actually in the saliva that's putting the body at risk? Is there even anything there? We should be doing
Well,
sleep.
I'm going to stop you there and ask a little deeper question. For salivary diagnostics, how do you choose your test? What are you looking at?
Yeah, I think there's a lot of great tests. I mean, let's be honest, there's like 10 right now. There's, we're in
Yes. More
2024.
coming.
Yeah, I mean, in 3 months from now, 6 months from now, one, I just want to say to people, if you're not testing, test. I don't care what test you use,
Okay.
because it's objective a point of view, and it's an objective information that you do not have just by looking at your patient. So I think my big message is just get more people testing. Now I am biased. I have my favorites, and probably, the newest one is actually one of my favorites because it's looking at everything on one test. I think that's one of the things that drives me crazy, is like, how many tests, how much
Right.
information do you need? So right now, like, simply perio is my favorite, and that can change tomorrow, but it actually looks at all the bacterial species. It actually, looking at the purple complex, the red complex, the orange complex.
What are these purple, red, and orange color complexes that Laura just mentioned? This color classification system was developed by Dr. Sigmund Sokransky in 1998. He categorized various periodontal pathogens based on their relative association with the health or severity of periodontal disease. The red complex consists of Porphyromonas gingivalis, Treponema denticola, and Tannerella forsythia, which are some of your most prevalent and well-known periopathogens relative to extensive and severe stages of disease.
Looking at the purple complex, the red complex, the orange complex, what I like about it is actually breaking up that Fusiobacterium nucleatum that we say is innocent, a healthy species. It actually breaks out the FA, the Fusium animalis, which is more virulent. So it's the only one right now in the market doing that. So that's really important. We can talk about all the, like implantitis, mucositis, there's so many things that revolve around that. And then systemically, in the GI, the brain, all the things that go with that. But it also gives you, which is really cool, it's going to give you your candida, so your yeast on there. And then it gives you your caries, so your cavity risk. You're going to see your strep mutans, but you also see the inverse relationship, the sanguineous. So you see, do you have health on there? And then they give you your viral targets, which most people are like, why do I need that? The herpes, the Epstein-Barr, your cytomegalovirus. Yes. Well, to me, I just sum that up in general for a hygienist, like, well, that's your host response. So to me, I'm getting all these targets and a little piece of the host response I wouldn't normally have. So right now, that's like my favorite because it's like, okay, I can use all of these targets and take a look at my patient differently.
Do you have any compelling case studies that you could share about some success stories using that?
Absolutely. That's always a hot topic for our industry. Where I stand, and we can get into that. I am a big believer that I guess I don't want to use the word cure, but I want to use the word like remission.
Yes, I want to get to this cure business too. So this is a good one.
Well, I think that I define periodontal disease differently than most people. I would say probably 99.9% of people. To me, it's on a test. It's like cancer, heart disease, or anything else. I can't look at you and say, you don't have cancer, you don't have heart disease. I can't. I absolutely can't. There's nobody who can. And it's no different in dentistry. I can't look at you and say you don't have gingivitis or periodontal disease. They are bacterial infections. So do you have the bacteria or not? And to me, that's the definition of those diseases. So if you have them, whether you're expressing them or not, if you have them, you, by my definition, you have disease. You have lost health.
So do you see like something like Porphyromonas gingivalis go to 0 in these tests?
Well, the lowest that we have right now is probably down to about 10 actual species of that. So I think as technology gets better, we'll see that. I say, my thing is get it to not detect it on these tests. In the world that we live in, as technology advances, we'll see that. But to me, we know the red complex, they can cross any lining in the body. They're going to ignite any inflammation. So if they're there, that pathway, that process is happening. And I think that's one of the big misunderstandings. Whether you see it happening or not is a whole nother conversation. But if they're there, then the potential, the risk, is there.
So if I understand what you're saying is by the tests, you're kind of saying if you're in a detectable range for these red pathogens, for example, you're going to diagnose perio, whereas other providers might insist on probing measurements and decrease of bone as a measure of perio. Is that right?
Yeah, because really bone loss and inflammation, that's just a sign and symptom.
Right.
That's the result of that happening. So we're waiting. Like to me, I relate it to cancer. We all have cancer cells, but when they go haywire, right, and they form a tumor, that's like saying to a cancer patient, well, I'm going to wait till I feel your tumor.
Right. Yeah, that's a fair point. I do get a little uncomfortable because with the ecology-based thinking, I think of something like Porphyromonas gingivalis, which we've seen in everybody, when our tests are very sensitive. And I do wonder if there's a benefit to having some of those proteases be very small concentration so that you're kind of lapping up a little bit of extra inflammation in the moments of the day that we have inflammation. You wake up, you get a pulse of cortisol, you get higher inflammatory markers just in general throughout the day. They shouldn't be too high, but they do peak in the morning hours, and then they kind of taper off throughout the day. And we know that this kind of trend exists, and we have these like cycles of activation and wound repair that are constant because we're masticating, we're chewing, we're disrupting tissues, we're brushing, we're eating, like there's a lot happening. It's one of the more provocative pieces of the oral cavity where we just do this crazy regeneration. There's no scarring typically. There's just this really cool cellular regenerative aspect of the oral tissue that is incredible. And all we need to do is like create the environment for it to do its thing, and trust that it'll happen. But that whole periopathogen aspect, that's where I kind of like walk this really fine line of, no, I don't want it either, but maybe kind of like the Fuso story, there's some beneficial strains that we do kind of prioritize for some specific benefits, but we haven't really sussed all of that out. So I just kind of like walk this fine line in this space. But I do know that the tests that are in market aren't as sensitive as the ones that we use in the labs, when we're really digging deep for gold in the research space.
Yeah, I guess my thought on that is, one, we always have to keep an open mind. Science is changing,
Yes.
but I look at it to really understand like the cellular pathway. I have plenty of patients who have no red complex. That is absolutely achievable. The second piece of that is understanding, especially, we can talk about porphyromonas gingivalis PG. It hijacks the immune system. It's there.
Absolutely.
And completely, the innate immune system doesn't even know it's there. It completely goes intercellular. It's going to change the cell.
Mm-hmm.
And it's going to hijack that cell. It's going to take over your white blood cell. It's going to change your mitochondria. So to me, unfortunately, we're in a sick country. We're in sick care.
For
So,
sure.
from the medical side, like if you want to create that inflammatory response, great. I'm a care coordinator. I'm going to teach you lifestyle and diet. I'm going to get your butt outside. I'll get your inflammation and your repair. Go work out, go run. There are healthy ways to do that. To me, this is a non-healthy way. And unfortunately, at some point in our life cycle, we only have so many resources. And when you wear out those resources to fight off these, that's why you walk in every, I'm going to say nursing home, healthcare home, and they have every inflammatory disease. They've worn that process out. It's done. It's like
Agreed.
insulin resistant. You've worn it out. You have no more resources left. So that's kind of how I look at it. I look at it as a longevity really process is, why would I want the mouth to be putting my body at risk when I could take that risk away? There are other healthier longevity ways to create that process. And most people don't understand that. I know you do, but that's how I'm looking at it, especially if I can take that away, knowing that they're hijacking that immune system and can create cellular damage on a much larger level.
Right.
And especially when we're talking about half of heart attacks, half of strokes. There's so much other variables, but unfortunately, heart disease is our number one killer. And I pick on women because more women die of a heart attack, of heart disease, than all cancers combined. And I'll say it again, all cancers combined for women. Yet we hear about breast cancer constantly, and I pick on it because we act like that's like what's going to get us, and it's not. And so you're going to get me on my soapbox about that.
Yes, well, I'm with you here because our symptoms are different. So I like all of it is it's just a really different space. Yeah.
So for me, clearing somebody of these high-risk pathogens, taking that risk away, I can't change their genetics, right? I can't follow them, make sure they're not eating, pick on fast food restaurants, right? Talk about inflammation in another way, or whatever they're eating or doing or lifestyle. but I can get rid of these high risk pathogens. I can get them to low levels. And in many cases, what I call eradicate them, put them into remission where they're not coming right back.
Yeah. I mean, absolutely high loads. I pick on Porphyromonas gingivalis just because I've personally worked so much on it, just like a lot of my colleagues. And, we have seen that it can permanently imprint on your immune landscape in a way that puts you at risk even after you've removed it from the mouth. And after you've cleared the inflammation, you still have this imprinting process that's going to affect you for life, increase your risk holistically of heart issues, autoimmune issues. Just the list is unending, it seems. So I'm with you there. Okay, I do want to touch on this. For the RDH who is moving in this direction, what if they have a dental provider that is, I don't know, laissez-faire, not on for the ride?
I have never met a dentist that I couldn't go sit down in their office and have a real conversation about being a provider. And hey, if this doesn't cost you anything and I can show you how this makes money, so I'm going to create healthier patients and I'm going to create a healthier practice for you. Are you on board? That's
Okay, yeah.
really all you need to do for your dentist. Are you on board? I want to create healthier patients. And in the process, it's going to create you a healthier practice, meaning it's going to make money. And I truly believe that. We do the right thing, the money comes. And that is true. 80%, I don't care, pick 70, 80, whatever from the AAP, have periodontal disease.
Yeah.
And it's the most underdiagnosed treatment in a dental office.
Yes.
So if you actually treat those patients, you're telling me a dentist is going to get upset that you're doing more services and he's making more money. I haven't seen it yet. I think that's that wall. Unfortunately, hygienists like to put up it, and that's probably fear, anxiety. I think we all share in that. I'm not going to say I didn't share in that, but I would love to empower more hygienists to say, "Hey, I want healthier patients." And you're going to get a healthier practice. Watch it happen.
Yeah,
I mean,
now I want to practice.
well, it's interesting how easy really, I'm going to pick on saliva testing, even though I am a huge believer in sleep testing, but saliva testing, especially, every company right now, all 10 of them that I know of, and gosh, there's probably one coming on the market today, but all of them, you get the test for free. Like they literally ship the test to you. And until they receive the test is when they get billed. So for me,
Wow.
this whole how do you get a dentist on board? To me, that's the easiest step because there's no money exchange involved for the dentist or the owner, so to speak. To me, it's like a win-win. Like how much easier can they make it for a dental hygienist to say, hey,
I did see that most of them are offering like HSA funds. So I could pay for my saliva testing with an HSA fund, assuming that, my work or somebody has that available for me. But is that true?
yeah, that's absolutely true. And United Healthcare just released, I think, November 2023, all of the coding that they now officially are looking at the coding for salivary diagnostics. So, 416, 417, 418, 419, depending, what it is. But it's happening. The shift is happening. When insurance companies say, hey, United Healthcare, we're going to start looking at these codes, that there's a shift. Another point to that, I'm just going to say the American Heart Association, they're doing healthy smiles, healthy hearts. They are begging hygienists to do two things.
Amazing.
That's their initiative, January 16th, 2024. You can go Google it, go on the American Heart Association, go look at their Healthy Smiles, Healthy Hearts initiatives. And in black and white, it tells hygienists, please take blood pressure on your patient. If they have high blood pressure, please refer them to a physician about medical dental. Right. We just want you to screen. And if it's high, let them know they need to go to their doctor. We're not asking you to do anything but that. And secondly, right underneath it says, please educate your patient that bacteria in their mouth can get in their bloodstream and contribute to heart disease.
Incredible. That's fantastic.
Two messages going on this year.
Oh,
So
is there a lobby for that specifically? Like I want to know these people.
I'll tell you who's behind it. Where you're making me go is because Delta Dental is behind the initiative. So how wild is that? We have two insurance companies that are like stepping forward when we say, oh, the insurance companies are, that's not true. And they've got some skin in the game. I mean, black and white, what's their skin in the game? Healthcare costs. If you treat periodontal disease, gingivitis, implantitis, their health costs come down. And so they're watching that happen and they're getting involved. So, like, again, for hygienists, a doctor, come on, you provide more service, you're going to make more money.
That's a very compelling story. I think that most dentists would be right on board. Okay, let's go back to the case studies. Do you have a good one to share?
The one that always burns in my brain, he actually wrote a whole blog on his journey. And not to mention his name, but he actually came, he was from everywhere. I mean, you name it. Mayo Clinic, Cooper.
Oh,
yeah. Okay, he was everywhere. He had the means to go everywhere. I think we were his fifth provider. So he came in, he had another heart attack. He had so many TIAs. He came to us and he said, nobody can figure it out. So he asked me, the little hygienist, I do my 5 things, right? So I'm going to do my saliva test. I'm going to do my sleep test. I'm going to do, the blood markers, through the office. We have our own phlebotomist there and everything, run the inflammatory markers. We're going to do our CIMT and we're going to do a cone beam and we're going to have it read. That's really important in this story because I pick on a lot of my colleagues who will do a lot of these things, but they don't actually have it read by a radiologist. And that's really important. And that's a key piece in his story. So, of course, his saliva test, he was high on all his pathogens. He had periodontal disease. But talking to my colleagues, everyone wants to argue he doesn't have periodontal disease. Why? Because he has light pink tissue. He has no pocketing. He has no bleeding. He has no subjective signs of periodontal disease. But objectively, on paper, he's blowing it up. I mean, he's got everything but AA. So I know his biofilm is very aggressive.
Wow. Is he a smoker?
Non-smoker, vegan, had been to Cleveland Clinic. He's like, I could go through the story with him. So I was trying to name some. I mean, if you've gone through Cooper Clinic, you've gone through Cleveland Clinic, you've gone through Mayo. I mean, this man's coming to us like he's gotten his lifestyle cleaned up. He exercises, he's completely vegan. When he came to me, we kind of changed some of that, I'll be honest. But, because we run genetics, I'm a big believer, stop listening to the media and find out your own genetics of what you should eat. But
Absolutely.
The big piece of the story was I took that cone beam and I literally was like, oh my God, like, am I the only one seeing this? There's so we go to have it read. He has 5 abscesses.
Sheesh.
Oh my gosh.
Silent abscesses. So now we're looking at his inflammatory markers and, for the physicians out there, they'll understand this, that MPO, myeloperoxidase, it's an enzyme, right, in the wall of the vascular system, in the wall of the arteries. And when that's high inflammation, right, we're on fire. This patient could have a heart attack. So one of the big correlations with that is these dental abscesses. And of course, his PI is off the chart, all of his red complex, but PI is actually one that I look at a lot with dental abscesses, a lot with implantitis, we see a lot. And, the
Did
conversation.
He have implants?
He did not. So this was the conversation. Are you going to pull 5 teeth so he doesn't have a heart attack again? Because nobody has stopped him from having multiple events. Yeah, now this is true medical dental collaboration because, you don't want to just tell somebody, well, to be honest, the cardiologist like, take out 5 teeth. We don't care. Get rid of it, right? Get rid of it. On the dental side, we're looking at those 5 teeth saying, oh my God, now we have a huge rehab case. And is it going to be successful? And, this takes on a whole nother meeting. So we really did work together with the cardiologist, and we did periodontal treatment. We did have some root canals. We extracted 2 teeth. We kind of did what I call, we've got to get out of this like monotherapy and have to really talk about combination therapy.
Yes.
The goal was to get rid of the red zones and rid of PI, and we did do that with combination therapy. There were antibiotics involved. There are lots of prebiotics, probiotics involved, and I think that's really important. That's really what I focus on in my protocol is like, what do I need to pull those infections down, whatever they are? What do I need to pull that disease state down? And then how am I going to create health so they don't come back? And that's really, to me, the biggest piece. Are we putting in things that can establish a new environment? So like your product, what can I use to create that environment that can sustain now putting in healthy bacteria? They have to be able to sustain. And so his case always sticks out to me because he actually, I think he's a writer. He wrote a book. He spoke on it. He was very vocal about, he says we saved his life. I say we did our due diligence. We uncovered every stone. I did not know in my room what stone it was. Was it going to be airway? Was it going to be, the saliva? Was it going to be the cone beam? Was it going to be the inflammatory markers? And to be honest, it was all of them. It was just putting the pieces together. And unfortunately, not to pick on the other providers, but they missed the mouth.
Yeah. I mean, that's typical. We were just having a conversation with a veterinary person, and it was just a miss to me. Like the vets know about this oral systemic space, but they do it all. Like they're not separate. So they have to know all of it. And so there's this, I'm going to say, disconnection between church and state here that is wild. Maybe that's an inappropriate combination. I should just choose something else, but I disregard. But anyway, it's all connected. Why are we separating? And so I'm just loving the work that you're doing. I did note that Gina Pritchard was a proponent of having a CIMT in practice. Do you use one?
Yes, so I work for her, and all of our patients get a CIMT. So if you don't know what that is, the carotid intermediate thickness scan. I think it's one of the best things to do in the dental office. We do them because honestly, as a hygienist, when you're having a conversation and you show somebody, hey, you have these high-risk pathogens, especially the red complex, they're putting your mouth at risk. But the next question is, well, are they putting your body at risk?
Right. And if you have some thickness there, then...
And so when we say half of all heart attacks, are triggered or caused, whatever you want to believe in the science, we can quickly, easily do a 5-minute scan and see if they have those soft plaques. Those soft plaques are full of these pathogens, they're endotoxins,
Absolutely.
It's really understanding that pathway, but it then makes it easy for the patient to say, okay, my mouth is putting my body at risk. I can actually see the thickening of the wall or actually a plaque.
Right.
And that's really what I tell my patients. Plaque in the mouth is plaque on the heart, which is plaque in the brain. Plaques are plaques. They're biofilms of bacteria that group together. So whether I'm talking about a plaque, on your coronaries or your arteries here, or plaque on your brain, right? Or I'm talking about plaque on your teeth. I just want you to understand, right, what that encompasses and how they're all connected.
That's fascinating.
Absolutely. I love the evidence too, just building it for the patient and making a nice, compelling story that really helps them visualize the connection. I think that's a really important piece. Not that I guess I don't know behind the chair, I would be just putty, but I know that some patients are more resistant, we'll say, and maybe don't want to take responsibility or maybe think that it's not as big of a deal as we all are kind of jumping and screaming in the corner. But when you're coaching the RDHs, are there any key issues that you see as themes kind of prohibiting this approach, or are they all pretty flexible in kind of getting creative behind the chair and implementing all of these strategies?
Oh, that's a dirty question.
Sorry.
It is. I mean, hygienists by nature, I mean, think about most people's initial reaction to anything is like, do not tell me. Like, I just graduated. I know what I know.
I know
Or
what I'm doing.
for 30 years.
Sure.
Don't come in here and tell me, I think
That's
that's
fair.
always the first reaction. Now there's the other side, but I would say most people are very like, I know what I know and don't tell me any different. So I feel like the first thing we do have to address is mindset. And that's
Yeah.
where I start with, like, you have to have an open mindset and you have to have a different mindset on what you're treating. I ask most hygienists this, like, I ask this nationally, by the way, almost every time I'm on stage. I ask this one question. I asked it at RDH. I think there was, I don't know how there's like thousands of people there, right?
Yeah.
Like, how do you make saliva, right? We're in the business of saliva. Can we all agree? We're in the business of saliva.
Yes.
We're
Yes.
mouth, right? And so I always ask like these two questions. The first one is just, how do you make saliva? And it's like crickets.
Yep.
There'll be a brave soul. Like, honestly, there will be a brave soul. It's like, our salivary glands make saliva. Yes, you're right. How do those salivary glands make saliva? Crickets. We don't even know how we make saliva in the mouth. And I find that interesting. And it's a pretty easy answer, but just nobody is taught that. And it has everything to do with some of my beliefs around periodontal is because saliva is made in the salivary glands, but it's made from the blood, the serum from the blood.
Mm-hmm.
Yeah.
And it's dumped on our teeth or comes up. Plus, we have all this microvascularity. And so the first thing about mindset is that we have to understand the pathways of our saliva. And so I say, when we talk about periodontal disease, there's really three pathways. Things everybody focuses on the gum tissue and the bacteria getting into the bloodstream that way. Okay, yeah, we have all this microvascularity. There's two other key components. And so I say, I want you to understand and study these pathways. We have bacteria in our mouth, the back of our tongue, our palates, all over, right? We're just like a cesspool, swab anywhere. But in the back of our throat is our esophagus. And these bacteria, whatever, all of them, viruses, they all penetrate directly into the esophagus. And that has to do a lot with airway when we study airway. But we're also lined with epithelium starting in the mouth, all the way down our esophagus, all into our stomach, all into our GI tract.
Mm-hmm.
We swallow on average 1,000 times a day.
Yes.
Yep.
These bacteria, actually PG, the one that you and I are talking about, it loves acidity. It loves GERD. It loves acid reflux. If you think it's getting the stomach and dying, it is not. It's proliferating. It actually loves it. And it's getting into your GI tract and it's then permeating into the GI. Where is it going? Into your bloodstream and your lymph. And where does that go?
Yep, exactly.
It's going right back in your blood to feed your salivary glands, and so we know minimally, science today tells us minimally, and we need more studies, but at least 25% is recirculating.
Yeah,
So
amazing.
mindset, I tell hygienists, when you tell me I'm going to go in there and clean it out, then you don't understand any pathway because the bacteria are not like, hey, I'm hiding out and I'm just sitting here, right? The saliva is moving.
Right.
Circular fluid. And then two, all the action of swallowing, the bloodstream, recirculation. So I think that mindset and that has a lot to do with why periodontal disease is recurrent. We don't understand those pathways.
Right.
We think it's just sitting in the mouth. It's a very misunderstood infection.
Well, I'm going to go a step further and say that a lot of them are going to be in our white blood cells, in our vasculature as well, which are coming into our gum tissues at, if no disease, 40,000 white blood cells per minute, and then in disease, quite a lot more. And so there's just a bedeckling all throughout. Like there's no getting out of this. Yes, preaching to the choir here. Okay, so I'm a patient and I'm looking for somebody like you to treat me, but I can't afford to go to Florida. What do I do?
Right now, we're seeing all this like functional medicine, oral systemic, one look at that. But honestly, I'm going to pick on our airway community. I feel like at least people with airway are looking a little different. They're doing some of these other things. They're taking CBCTs. They are looking a little bit beyond the mouth. And the reason I pick on airways, one of my talks is airway to pathogens to plaque. I actually feel like airway, we have to understand that when we just desaturate, you don't have to have sleep apnea here. Just literally not getting enough oxygenation, our oral microbiome shifts.
Yes. Yep.
Like once you understand that, like you're not making nitric oxide. If you're not nasal breathing, you're not making nitric oxide. But then, we're going to talk about how you lose nitric oxide in your mouth, but that's one of the ways, just mouth breathing, you are shifting that environment. And one of the biggest things is you're losing healthy common souls, these nitrate reducers, and you cannot then make nitric oxide.
And so why is nitric oxide good for us?
Yeah, so important for overall health. What you're getting to is heart, vascular. But right. I tell hygienists, you take blood pressure on your patients and you know that the vessel is expanding and contracting. Again, what is allowing that to do that? Nitric oxide. We have to be bathed in nitric oxide. Yes. So huge vascular component. And it actually is what keeps a lot of our junctions nice and together. And so if we're not making nitric oxide just from this oral cavity, nasal and the mouth, you're in dysbiosis. And now that patient, right, is at huge risk. GI, vascular, brain, all their linings. And so I think that's another huge piece. And so again, as a patient, I'm looking for those things. I'm looking, hey, are they looking beyond cavities and just like gingivitis? Obviously, somebody who's testing, so you can go on all these testing things and see who in your area. And that's what I would tell you to do. Google, your local dentist. And then I say your AOSH community, the American Academy of Oral Systemic Health, your IOA, MBD, your
So does AOSH have like a cumulative list?
A registry.
Yeah. So you can just go in and search. Okay. That's great.
Yeah. I think just looking at all those types, it's kind of like for a physician, looking for these types of functional, types of dentists, biological dentists. A lot of them are going to have different names so that you can look at that. And I think that helps, and just ask. They may have a saliva test sitting on their shelf and they're not really advertising it. That's the other thing, unfortunately, because it is new. So I think just researching that and trying to find, they are out there. And then, I'm vice president of, integrative dental medicine. And so I think more and more like us, we're going to be putting the names of dentists who are certified in doing this, but it's going to take a while.
Yeah. Oh, I'm excited.
Yeah.
What does an airway test look like in clinic?
I'm a big fan of an official sleep test, or, you can go get your polysomnogram and all of those in sleep tests. I actually, there's so many great ones. I'm just a fan of either and I'm going to name a couple names, but there are other companies. So please do not beat me up on saying this, but I'm just a fan of two that are out there. One is just WatchPat because it's easy. Like you take it home, you put it on, you have to hook up two things and it's disposable. You throw it in the garbage. So when people hear me talk, I'm not I always say it has to be good for the clinician, good for the patient, and good for the practice. Like if they meet those three criteria, it's easy. It's a lot harder to send somebody to an in-sleep center, but I am fans of those, especially when we need them. But I'm also big fans of then monitoring somebody because one night or 3 nights, doesn't tell the story. You really, if somebody drinks, they got to have it Thursday, Friday, Saturday. You got to have life here. So I'm a fan. Like, I wear an Aura ring. I think the new company that's emerging that I really like is Empower Sleep, is where you wear like a sleep image ring and they watch you for 30 days. To me, it's like saliva testing, like before and after. They're monitoring and actually seeing what you're doing, and they coach you. Like, you need a mouth tape, need these nasal dilators, you need good sleep hygiene, what's the temperature of your room, get off your phone, like all the things we know, but you actually have a physician, a sleep doctor directing that all the way to, hey, do you need nasal septum surgery? Do you need your tonsils out? Do you need, mandibular advancement? Do you need advancement, or do you need an appliance? Or, they're going to help you walk through that. So I just think it's a huge service. And that has a lot to do with why we get recurrent periodontal. We're never looking at like, what's the root cause? I'm a definite root cause person. I'm not just here to say, oh, you have bad bacteria, you have periodontal. That's the end all be all. I'm like, well, why? Like, why are we getting these bacteria? Yeah. Why is health going away? Oh, and I would say, a large percent of our population, the airway is definitely a variable or a factor in that process, besides, who we're kissing and drinking our coffee cups or what we're putting in our mouth. But, I think it's a huge, again, overlooked piece that a lot of people could get better health.
One of the observations I recently made was actually the aging population, that your breathing muscles can weaken over time. And I was horrified to hear this. Not surprising. I am in aging research after all, but I was not prepared for, the swiftness for those pieces to kind of devolve on me. And I was surprised. Definitely not something I was looking at holistically. I was thinking, diet, exercise, making sure I'm doing all of the kind of basics, but breathing was not actually even in scope. And so having that be a new conversation for me, I think it might be for others as well.
Absolutely.
Yeah. My world of heart disease. I mean, when do most people have a heart attack?
Yeah.
They say at that 3 a.m. hour, it's fight or flight. You're not getting enough oxygenation. Your body is going to do everything to keep you alive. It's going to open, it's going to flood the gateways. It's got to get blood and things to your organs. And people don't really understand that. So I say sleep could be a huge window into all of these things. So, I mean, I just put the story together. Somebody's not oxygenating. They're putting so much pressure on their vascular system, right? They don't make nitric oxide. So now they don't even have nitric oxide to help their vascular system, right? You have to have it to expand and contract. So now you're not functioning properly, right? And oh, by the way, you're in complete dysbiosis. You don't have healthy bacteria in your mouth. And then, Camilla, I'd love to talk about, oh, by the way, you used mouthwash before you went to bed to wipe out again. So you don't do it. Have it going to bed to even help you process any of that. And then you're swallowing these guys and they're just permeating. And oh yeah, you have a bunch of soft plaques on your coronaries, on your carotids. And right now you're like in fight or flight and you wonder why like something ruptures. I mean, nobody talks about that in that context, right? It's kind of like, well, you might desaturate. It's no big deal. Throw this appliance in your mouth. That's not an answer. Or here, just get on a CPAP. My takeaway of everything that we do is the treatment working. If you are in a CPAP, great. Test with your CPAP. If you are an appliance, test with your appliance. It's just like the work I do. I'm trying to pull down pathogens. I did a treatment. I test after the treatment. Like, is it creating health? Is it working? And I think that is just a big message to patients and even to hygienists. Get out of the insanity. What is actually working?
Yes.
You mentioned earlier about your case study of how they went to Cleveland and all the different stops before they ended in your space. And And then later on, obviously, we just talking about airway. Do you also ever work with nutritionists or dietitians when it comes to trying to address the root cause? Because as we know, sleep, exercise, all these important habits do contribute to our cardiovascular health. And when I think about nitric oxide, diet plays a big role in that also. So I was wondering if that was part of your programming.
Yeah, I guess I take that as a given working now on the medical side. That is like their number one. I guess, I'll put my hygiene hat on. It's pretty wimpy in the dental arena, but in the medical side, it's key. I mean, lifestyle diet is number one. We have to address that. And it's not easy. It's not easy. We can talk about some of these bidirectional, like we put a continuous glucose monitor every single patient.
That's great.
I love that.
That's fantastic. Yeah.
We do genetics on every single patient. So there are some key takeaways from that. I'm never going to tell somebody, kind of like my vegan patient, if that's because like spiritual or you have a reason, like I don't want to eat animals, that's very different. I'm going to work around that. But if you're just like, oh, I'm vegan because somebody told me to be vegan, in this case, he was just told, okay, well, I need to look at your genetics.
Mm-hmm.
What do you look at with genetics, and perhaps even what tests, and how do you make some of those calls for them?
Yeah, we run a whole panel, but I'm going to just talk about two really important ones. One is that APOE gene. You hear about APOE4 for Alzheimer's, puts them at higher risk. And we know that. And those patients really have to watch their diet. Now, if you're going to tell me out of APO, there's 3 twos, there's APOE3 and APOE4, and then you can have combinations. If you said to me, Laura, just black and white, if somebody's going to be vegan, yeah, you're 4s. They really have to watch their fat, their diet super strictly. It's going to be way more beneficial. They can't drink alcohol. They're the ones, if you give them a glass of red wine, it actually increases their cholesterol.
Wow.
Like I see it killing them, where an APO3 is your true like Mediterranean. If you give them a glass of red wine, actually it's beneficial and helps keep that. So it's the total opposite. So, and then you have your 2s, which this patient was a 2, and a 2 is rare. So 2s and 4s are like on your outskirts. So if you said 80% of the population's Mediterranean 3s, right? 3s, they get to eat 33% fat. It's all your macros, right? Your protein, fat, carbs. 33 protein, 33 fat. They're the lucky ones, right? They can kind of take in these carbs and fats, and that's the person who're like, they like crap, like nothing happens. There's a lot of people who can get away with that. Then you have your 4s who it's like, you can't drink alcohol. You got to watch where your fat is. Like you really have to be careful and you have to be strict. And a lot of them do see huge benefits being vegetarian and vegan, like really watching that. But your 2s are on the opposite side of that, of fat. They actually have to eat at least 33 or higher percent of fat.
So keto's great for them, right?
I'm the 10% population. I found this out really late in life. I was actually vegan. No surprise there. I've done it all. Vegetarian, thought I need to be vegan. And then, Dr. Pritchard is like, how many times do we need to run your blood work and your genetics for you to make the switch, not get in your head? And it's just like, it's like, I didn't want to believe like plants are killing me, but there are people that plants are not beneficial. A small percentage. I'm in that 10%. I am a 2. This patient that I was telling you about that was vegan was a 2. So we had to have a conversation that you have to eat a lot of fat. So my vegans and vegetarians, I'm not talking, a cheating vegan, I call them, or they're eating everything processed out of a bag. Like that is not healthy fat.
Yeah.
You want to eat avocados and olive oil and avocado oil. Like we got to really talk about, and this guy's like, no, I'm only vegan because I was told I had to be. Well, nobody looked at his genetics. So we started bringing in slowly like higher fats, healthier fats, organic beef and, eggs for breakfast, cage-free eggs, trying to get high fat content, avocado and like everything, and really talking to him, cashews, the fatty nuts, like what can we bring in, get your omega-3s really high? Can we start with fatty fish, get the salmon? So Jonathan, you're hitting the nail on the head. Like lifestyle diet can really reverse so many of our diseases. But I'm going to tell you, it's one of the hardest. And that's
Yep.
why I like to use these continuous glucose monitors, because somebody will tell me, oh, I was so good, or I did this. And then it's like, I see their spike and I'm like, what did
What
you
was
have?
that?
Oh, well, that day, I had that. One of my tools I just want to share, because I'm a huge fan of hers, is the glucose goddess. I make all my patients follow her, get the glucose revolution, because I really practice a lot of the cheats, like eat a savory breakfast, like don't start your day with sugar. If you're going to have the piece of cake, like dress your carbs, have a handful of nuts, have, something else before that.
Can
I
I
teach
sprinkle psyllium powder on it?
cinnamon. People do all kinds of things. There's so many health hacks. Eat your protein and fats first. Really, carbs should be eaten last. They are dessert.
Yeah.
Fruit is a big one. I just like beating my head. Literally, I think I have holes in the back of my head of how many patients want to eat oatmeal and fruit and want to tell me that's healthy.
Yeah.
And it's literally, I say poison. So you're putting in grains that are poison and sugar. I'm confused. Just
Yeah.
really confused. But you put a glucose monitor on them and all of a sudden they're like, I don't know, every morning, they're straight up. I think it's something we're eating. But that's the second marker I look at, the heptoglobin. It's like a corkscrew that is in there, and heptoglobin ones can get away with eating carbs, and gluten a little way more. And heptoglobin twos, they cannot. And so if you're a 1-2, I say you have to be like gluten aware. If you're a 2-2, so you always have two strands, one for your mother, one for your father, and we're looking at genetics, those twos really need to cut out gluten. So again, going back to my story with this guy, Jonathan, I worked on, okay, you're 2, you're in the 10%. Maybe that's why nobody could figure out as well. Big piece of his story, because he's doing all the exercise. I'm talking breathing, cold plunge, sauna. He's like all out, right?
Wow.
Yeah, this isn't
Wow.
a little, hey, start to lift weights. This guy's running a couple miles a day, doing his, strength training. And so really it was just looking at him. I say, we have to look at our patients through a different lens, put your glasses on and look differently. And I'm not
Yes.
talking about the masses. I'm talking to him.
Yes.
Like, don't tell your wife or your family to eat this. I mean, maybe your kids if they have your genetics, but I'm just talking about you. And that was a game changer. So he was heptoglobin 2-2. We cut out all gluten, really talked about processed foods, grains. It's really his enemy. I mean, it just is in his diet. And so he had a huge aha moment, because I say he was a bad vegan. I mean, eating Tostitos chips, with fake
It's
cheese on
hard to be
it.
a good vegan.
Yeah.
It's hard, I think.
Not healthy, right? I'd rather you have, some salmon and let's talk about healthy salad or vegetable and broccoli. And yeah, let's talk about what your body like functions on, the cells are wanting. So I think
Yeah.
you just nailed it. I mean, we cannot ignore that. It's just unfortunate most people don't have that piece of information.
Yeah.
Yeah. But I think between, like you said, the glucose monitoring, the saliva testing, and all this stuff you have implemented into your practice and program, that's personalized health. That's a model that I personally would love to see become normalized. Right.
Exactly.
And I'm curious to see what you think are the types of efforts that could help make that more common, not just in the States, but other places as these technologies evolve, but hopefully become more accessible and cheaper.
Well, I tell hygienists all the time, you can do a finger stick at the chair for somebody's glucose.
Yep.
And see those numbers. I used to do that before the continuous glucose monitors. The other thing is so many patients are into this now because of TikTok and Instagram.
Yes.
Tell them, go get one, because we know with insulin resistance and diabetes, it's a bidirectional relationship. You have high glucose in your blood, you're just feeding these bacteria.
Yeah.
So I'm over here trying to wipe them out and you're growing them.
Yeah.
Doesn't work. So we
Yeah.
have to have a conversation about that. What does that look like for you? And some patients don't want to go there. It's okay. At least I'm making them aware. Again, to like, how do we truly get into remission versus, okay, we're going to be cyclic, because of insulin resistance. And that's a huge conversation in our country. But I think people are having fun with it. And I say to hygienists all the time, have fun. It's trendy. It's our conversation to have.
Yeah.
And you don't have to be administering it. They have so many ways to go get them now. Let
Yeah,
them do
it's
that
true.
and use that information, or
Yeah.
they can even just finger stick. I told you I had 5 kids. My youngest is actually a type 1. So it hits home for me.
Oh, wow.
Wow.
Diet and lifestyle and insulin reason, just watching, that's the flip, but it really makes you understand the pathway. I tell people all the time, if I want to save my son's life in the middle of the night and I want to be remotely, not just throw a juice at him, which is interesting, juice, fruit, what's the next best thing I could grab out of my refrigerator? Fruit.
Yeah.
Fructose is going to save his life. Sugar is what saves glucose. That should all hit home to us like, that is not healthy to just go eat a piece of fruit.
Right.
Now, if I want to eat it with some peanut butter, I want to put some nuts on there, that's a whole different conversation. But most people are thinking, hey, I'm just going to go eat a bowl of fruit. And I say, can your body handle it? Maybe you're 3'3" and you can. But with what we're seeing going on in this country, yeah.
I was reading an article, a scientific article talking about the criticism behind kind of general practice medicine, and that we're, putting SOPs out there that we know are harmful just because we are kind of, I don't know, stuck with them. And we don't get this kind of holistic reassessment every so often. And we really need, I think, a generalized redo on how we implement medicine in general. But that's that's a much bigger conversation.
Another episode, Camille.
But I was definitely feeling that personally when I had to go for my time of life colonoscopy, and they were like, drink all of this apple juice for 2 days straight. And I was like, really? That's terrible. What, are you kidding me? You want me to have diabetes while I get my colonoscopy? Okay. All right. Sign me up. Feels terrible. But anyway, I'm looking forward to the holistic change that's coming. I do feel like everybody is on TikTok kind of like really eating this preventative medicine up. I think COVID has been a really good experience for us to really see how our comorbidities are putting us at risk, just globally speaking, in the current time. So I am so grateful that you were able to sit down with us today. This has been an incredible journey to watch and hear and listen to, and I'm really looking forward to the changes. I love that Delta Dental's got skin in this game. I love that the American Heart Association, is that how it's AHA? Is it AHA? That they're also on board. Like, this is fantastic. This is such good news, and it makes me really excited and hopeful. Not to mention that, it seems like all of these kind of health and wellness experts like Huberman and Peter Attia are really jumping on the bandwagon of oral health being a pillar of health. That's one of our essential pillars of health. And I'm pretty sure I say this every episode, but as a microbiologist back in the 1600s, Antoine Leeuwenhoek made his first discovery of microbes in general. It drew them in his journal, and they were oral bacteria. And only now are we saying, oh, look.
They matter.
They do matter. Oh my goodness.
I really hope you're coming more to the forefront. I know you've had a couple of interviews. I think just what you're doing in the space needs to be talked about more. I'll be honest, one of the things that like attracted me to you and to your product is just that we're speaking the same message. I think that's the biggest thing to hygienists and to patients are like, what are you putting in your mouth? You said something during our talk. You said, and don't quote me, restate it if I say it wrong. But what my takeaway was is you said people are treating their mouths like their toilet bowl.
Toilet. Yes.
Yes.
All of these like septics, antimicrobials, and we're just like killing health. And that was like, I love her. Like that is
great.
like my world. You're like, speak my language. The thing is like, I don't think our population or even hygienists understand that we are unconsciously like, here you go, handing a product or taking a product without asking, is this helpful? Or
Yeah.
better, is this harmful?
Right.
And that's what I love about what you're doing and your message, and just any way I can share that, because to me, that is a huge topic. I think what the World Health Organization said, antimicrobial resistance, everybody wants to talk about antibiotics. And I laugh because you said COVID. That's what we saw during COVID and testing. I think I've overseen 10,000 saliva tests. All of a sudden I saw them go up during COVID, and the one common denominator kept coming back why these people are getting more and more pathogens was antimicrobials. Everybody's like, couldn't swish enough, couldn't gargle enough. Like, well, I never used that before. Now I'm using it like 3 times a day. It's like the science is there. So I love that you're bringing that forward, because we need more of that. We need more voices out there. I think patients are just so, unfortunately, and hygienists, our dental colleagues are misinformed.
Yes. Well, I mean, it doesn't help that, there's all this research showing mouthwashes do decrease the COVID virus. But I'll tell you what, periodontal disease puts you at significant risk for mortality with COVID, like that, hand in hand. And mouthwash is not going to be doing you much favor. I mean, I will say chlorhexidine has some compelling perio research, but long term, every day, these treatments should be limited, definitely. And and I think, I said during that talk, I don't want to throw all of oral hygiene out the window. I think some of us are more sensitive than others, but do we know how to test for who's sensitive? No, we just know what's not working is whatever they're doing that brings them to you and has them in dysbiosis. Whatever is currently happening there holistically, let's reevaluate everything, including the products that they're putting in their mouths. So yes, absolutely. I will say for me, I felt like I was born with gingivitis, and I think that it's true that there's a genetic risk, but I think that mainstream oral care did not work for me. And that's why I was so motivated to find something that did work. Yeah. But I mean, again, we're all very different. And
I say, come on, it's 2024. We have so many better products. And I think that's honestly where I stand, is you are not walking around with a cord on your phone. Like, why are we products that we invented like from 1950?
In the 50s,
I mean,
exactly.
Kills me. I know.
I mean, we have amazing scientists like you that know, I'm going to say know better. So if we know better, Maya Angelou always says, then do better. And that's where I feel like we need to bring hygienists up to, education. They just need education and probably need to hear it a few times. That's why I'm always like, what's the mindset? Because then their skill set changes, right? If you can switch my mindset to, hey, I don't want to treat this mouth like a toilet bowl. I hope I said that right.
Yes, you did. No, it's like, true.
I think, you need to walk into every dental office and say that. It's like, what are you putting in your patient's hands and what are you using? There are better things. So let's switch the mindset, switches the skill set. And then I say, like, our tool set, then what's in our toolbox to give our patients? Can we give better products, give better communication? And I just love where you guys are going. It's, it's really important. I know it's slow, but
we're getting there. We're getting some traction. I feel it coming.
Yes. This is the year.
And really, it's places like IDM Society, the AOSH, all bringing together like-minded people to get the message out. And I thank you so much for doing that, because it's fantastic. I love the case studies. I love the outcomes that we're seeing, really changing people's lives and keeping them out of a 3 a.m. heart attack.
Really.
Anyway, I'm going to close out this meeting. Thanks again.
Thank you so much, Lora.
Yeah. appreciate being here. We get more hygienists saving more lives. I just say that's really my big mission, and I think just all of us educating, that's what's going to change it, just
And collaborating. The collaboration piece, I think, is so important because we all have to be aligned, right?
Yep.
we do. And they're out there. I speak with MD-VIP. I just have to share that from the dental standpoint, everyone thinks there's no physicians out there. I'm on the physician side. I know what they say. There's no dentists out there. So I think we have to, raise our hand. Hey, I'm here, and make it really easy. And that's another piece I was just trying to do, is show it's really easy with like this, the right products, the right communication, and the right tests, objectively, and all speak the same language to each other. And that's where everybody's collaborating. Then everybody's like, oh, yes.
Yeah.
We can.
That was one thing on the Huberman, where he had talked to a bunch of people and they were all pretty much in alignment. And that was like music to my ears. That's all I needed to hear to close out the episode. We're all in alignment. I'm good to go. All right. Well, again, thank you so much for being here. And I look forward to working with you specifically in the future. It's been a joy.
Thank you. You too.
Let's get